Again, thank you for everyone tuning in. We have Dr. Kevin Jefferson. He is definitely going to be sharing some gems and jewels, a little bit about himself, his brand. For those that don't know, I'm D Weeks 2000. I moderate all of the interviews here at Black Business Legit. So, Dr. Jefferson, we definitely thank you for tuning in and just sharing some gems today. We're not going to keep it too long, but we just want you to introduce yourself and tell us a little bit about what you do.
Well, thank you, Black Business Legit, for yourself for inviting me to participate in your program this afternoon. Like you said, my name is Dr. Kevin Jefferson. I'm a podiatrist here in Washington, D.C., nation's capital. And I have a YouTube channel called DC Foot Doctor. We've got almost 115,000 subscribers. And what I do on that channel is basically what I do here. I provide foot care and foot surgery. And on the channel, I talk about what we face in podiatry, my approaches to dealing with them, and I promote and educate about good foot health, particularly for our diabetic populations, our older populations, but anyone who has foot issues, who have friends or loved ones that have foot issues, they come in, and we take care of those issues. And the DC Foot Doctor channel on YouTube is just another way that people can learn about what I do and what we do in podiatry.
Gotcha. So I guess my question becomes, what led you to that particular specialty, of healthcare? What was it? Someone that kind of put you in that pathway? Was that something that stood out to you, or how did that all happen?
Well, when I graduated from Prairie View A&M University in Texas, and during that time, the Health and Human Services was looking to increase the number of podiatrists in the United States. They were predicting a significant shortage of podiatrists in the coming years. And so the podiatry schools, which there were 7 at the time, had a big push to increase the enrollment of the podiatry schools. They were pretty low during those times. And so I was one of the fortunate ones that benefited from that recruitment, if you will. And so myself and some others, and a frat brother of mine, I'm an alpha, who went to podiatry school a year ahead of me in New York. So I followed him in that next year. Thanks a lot, Eugene Crank out in California. So a lot of people were able to enter podiatry school during that time because of this. We got some scholarship money, and the rest is history. I've been going at it now for a little over 20 years. And that's how basically I got into it. I always wanted to be in medicine. I wasn't exactly sure which path, but when this opportunity.
Gotcha. Awesome. So, and I guess my next question would be, when your clients come to you, a lot of people, I say, when they say doctor, I mean, obviously you have tons of different specializations, but I guess what is some common misconceptions about podiatry, for those that are unaware, of different problems or different issues that, you see a lot coming into your office, and maybe how can we as individuals help prevent that before we have to come see you, or should we come see you on a regular basis? What would you say to those questions?
Well, probably the biggest misconception about podiatrists is that we're not doctors. But we are. Our training is very similar to what we call allopathic doctors or MDs. Same structure, 2 years in the classroom, 2 years in the clinic, postgraduate residency and fellowship. I did my residency I went to school at New York College of Podiatric Medicine, did my residency at Brooklyn Hospital, did a foot surgery fellowship at the same hospital. And the misconception is that we're not physicians, but we are. We specialize in the foot, ankle, and lower extremity. Another misconception about podiatry is that all we do is take care of toenails. But we take care of all issues and all manners of pathology, if you will, of the foot, ankle, and many times the lower leg. Diabetes is a big part of the podiatry world, dealing with not just regular foot care, but dealing with wound care, advanced wound care, saving limbs. We prevent limbs from being amputated. We help to heal wounds.
Really?
And, yes, sir. And so a big part of my practice is wound care and limb salvage and diabetic foot care. We are adept at diagnosing circulatory issues of the foot. We have a vascular team that comes to my office once a week. We do all our vascular scans. We take care of athletic injuries and athletic problems, flat feet and all of those type of things. And we're also foot and ankle surgeons, not just bunions and hammer toes, but severe trauma. I've removed many bullets from feet and legs, from gunshots. Motor vehicle accidents, people stepping in holes, or athletic injuries and things of the nature. Repairing Achilles tendon ruptures. So you name it. If it can happen in the foot, podiatrists are here and ready to deal with it. So that's what we do.
That's amazing. That's amazing. Again, if you're just tuning in, and the people at work, so they're going to be jumping on and off. But if you're just tuning in, we have the DC Foot Doctor in the building, Dr. Kevin Jefferson. Again, is just going over some of the myths, the misconceptions about podiatry, and dropping some gems and jewels on us. Let's shout out a few people that joined us. DMV Mobile Cairo, good to see you, family. She's normally one of our watchers. Shine Always, Entrepreneurship Quotes, good to see you. Resurrected Treasures, Lano 45 million, Elise Cole. Let's see, Miss Franklin tuned in. Good to see you, family. JC 87, she's on all the time. Black Votes Matter 2020, yes they do. So I guess when I guess another misconception is, as a young person, and I'm 32, but as a young person, a lot of times I know that, my mother, my father, people in my family urge me to go to the doctors. And I'm not going to say I'm, one that takes the advice as much as I should. But should young people come to see you, 16, 20, 25, should they come to see you? Or is podiatry more something for people that are older, up in age? What would you say to that?
Well, most of our patients are older, over 50, over 60 maybe, but we see patients of all ages, from newborns to my oldest patient is 104. And so, so when there's a foot issue and you're not able to resolve it on your own, or with the help of a loved one, a parent, or whatever it is, podiatry should be your first area of thought to go to. All right, because we deal with patients of all ages, of all stripes. So foot health is good health, total body health. All right, we don't consider the foot as separate from the rest of the body. So we take holistic approaches to making sure that you have good health, so that everything else is in line. Like the old folks used to say, when your feet hurt, everything hurts. And biomechanically, that's true. If you have a foot problem, it could lead to ankle, knee, hip, and lower back issues. Maybe even mid-back and shoulder issues, neck, when things get out of alignment. So we're here to do things to help with those type of issues as well. So if we're seeing ingrown toenails, we see a lot of ingrown toenails in teenagers. And most of the times because teenagers don't trim their nails correctly. So most of our ingrown toenail surgical procedures are in teenagers, not so much in older folks. And we deal a lot of flat foot issues and developmental issues in our younger patients, our toddlers, elementary school age patients. So we deal with it all. So if there's a foot problem that's not taking care of itself, it doesn't always have to be very serious. If it's not getting better, whether it's skin, nails, deformities of the foot, or just a pain, you just don't know what's going on with it, where it's coming from, what caused it, then the podiatry is the first route you should take.
Mm-hmm. And if you have not had a chance, for those that are watching, follow the DC Foot Doctor. Again, DC Foot Doctor, we pinned his name below, his screen name. Dr. Jefferson releases tons of information on YouTube. So if you are on YouTube, please subscribe to his channel. You can also follow him here on Instagram, just in case you have a question or there's something that you didn't get answered and you want more information. If you're in the DC, Maryland, Virginia area, which most of our followers are, we strongly suggest you can actually sign up to go, check him out. He's on Georgia Avenue Northwest in DC. So again, just doing a lot of great things, Dr. Jefferson, to release some really great information, some stuff I didn't even know. And, you know, I have a few doctor friends, but I think, like you said, the foot is probably one of the most, overlooked part of our body that, you know, I think that we definitely need to stress more health on. So I just want to, you know, leave the people off with a couple of jewels, a couple of gems, as they say. I know you gave us a lot of information, but if people are having different issues, you know, how can they just get in touch with you? What's the best way?
Well, the best way, of course, is always telephone. The number is 202-882-9682 if you're in the DMV. I also provide telemedicine. If you're not in the DMV, you can start that way. I have had people travel to come see me from California, from Florida. I've done telemedicine visits with people from all over the world. But the contact info is also available in the description of all my videos on YouTube, or in my social media profiles. You can go there to get all the information you need, whether it's through social media, telephone, email, you name it. Multiple ways to get in touch with me, calling the office and setting something up.
Excellent. So you heard it here first, family. Again, if you are following the DC Foot Doctor, all you have to do is message us. You can just send us a message. We appreciate Dr. Jefferson for just spending a few minutes of his time. He didn't have to do it, but he chose and humbly do it. But again, he has a ton of information on his page. I think, again, it's one of the most overlooked specialties of medicine and healthcare is podiatry. So please get involved. You know, definitely follow. Even if you yourself might not need the services, you might know someone in your community, your neighborhood, a friend, family member. You can share that again in our community, so we can continue to educate and to inform. So, Dr. Jefferson, we thank you, and we hope to, you know, maybe tune in. Again, you know, I know that you have office hours and we want to respect that. But again, we appreciate your time.
All right. Thank you very much. Everybody out there, take care of your feet now.
Hey. All right. Thank you so much. Stay tuned. Peace and love.